Welcome, everyone. Thank you all so much for joining. On behalf of the University of California Center for Climate Health and Equity, the Eco Health Center, and the UC Climate Change and Mental Health Council, we welcome you here today. Our six-part webinar series on urban wildfires is being co-hosted by UCLA Center for Healthy Climate Solutions, the Jonathan Fielding School of Public Health at UCLA, the Sustainable LA Grand Challenges, the UCSF Alumni Association, and the communications team, both at UCSF, and the UC Office of the President. I wanted to thank a large team who made this webinar possible, including Ariane Tehrani, Alyssa Eppel, Jyoti Mishra, Dick Jackson, David Eisenman, Tarek Ben Marnia, Neetha Thakur, Sigal Maya, Anne-Marie Charlesworth, and Annie Rosenthal, among others. So just to get to the content of our webinar, so we know that the LA fires have been contained for close to 2 weeks. They together burned nearly 60,000 acres, or around 90 square miles, an area that's almost 2 times the size of the city of San Francisco. More than 16,000 structures were destroyed, many others damaged. Tragically, 29 people lost their lives. Many people had to evacuate their homes. And we know that ash cleanup and water safety are continued challenges. So with this backdrop, in today's session, we're going to be discussing the social impacts of the LA wildfires, as well as community response and recovery. We know that the LA wildfires caused widespread job losses as businesses burned down or closed due to evacuation orders, which worsened financial instability for many families. We saw food insecurity surging as supply chains were disrupted and grocery stores were destroyed. And we also found that displaced individuals have been struggling to meet their basic needs. In addition, we saw that the fires fractured communities, forcing people to relocate and leaving many without the support structures that they once relied on. So from this background, we're going to hear from a range of experts and community leaders who have worked closely with wildfire survivors in LA and other regions to foster healing and resilience. So in addition to focusing on the social and economic impacts of the fires, our discussion is going to highlight how communities rebuild after devastation, the role of mental health support, and the ways in which collective action can really help people recover and strengthen their communities in the aftermath of these fires. Just to remind you all, these webinars are being taped and links will be sent out to all of you who signed up. And you can find resources on our website, which we will include now in the chat. And we're hoping that our center will continue to serve as a resource for the UC community and to others in California more broadly. Please disseminate these links to others that you think may be interested. If you have questions during the webinar, please post your questions using the Q&A function on Zoom, and these will be answered at the end. And I will now introduce our panel speakers. So we will first hear from Lara Cushing, who's an associate professor of environmental health sciences and the Jonathan and Karin Fielding President Chair in Health Equity at UCLA. Her research focuses on patterns and consequences of social inequities in exposure to environmental hazards in the U.S. So she has assessed the health consequences of environmental and climate-related exposures for pregnant women and infants, and investigated questions of environmental justice in the context of air pollution, urban green space and heat islands, oil and gas drilling, drinking and water quality, and sea level rise. And she will be speaking to us today about the social and economic effects of wildfires and other climate stressors using an environmental justice lens. So welcome, Lara. We're thrilled to have you.
Thanks so much, Sheri. So, thanks for the kind introduction. I was asked to describe some of the social and economic effects of wildfires and the disproportionate impacts to vulnerable populations. So during the fire, of course, there are immediate threats to life, to property, the local economy, air quality from the smoke. After the fires have been extinguished, there can be long-lasting impacts associated with displacement, housing insecurity, lost jobs, wages, and business revenue that results in financial insecurity and food insecurity, disruptions to schooling, childcare, recreational opportunities that are lost, as well as social networks and important systems of social support. Today, in particular, in LA, we are concerned about the prospects of mudslides and the burn scars due to rain, leading to further injury, property damage, and water quality impacts. And while people from every walk of life have been devastated by these wildfires in LA, the impacts and the recovery are uneven because of what's been termed the climate gap. The climate gap refers to race and class-based disparities in the effects of climate change, and that amplify existing health, social, and economic inequalities. So impacts are greater among communities with the fewest resources to anticipate, prepare for, mitigate, and recover from climate-related disasters. This map here is from a review of 90 health studies that have been published since 2017, in which we found that the majority of studies find that people of color experience worse health outcomes during extreme weather events whose occurrence and severity are increasing due to climate change. So for example, African Americans and Native Americans in the US are more likely to die from a natural disaster or an extreme weather event. This is because of structural inequalities that render particular populations more vulnerable. So vulnerability is a function not just of being exposed to the direct effects of a natural disaster, but also the sensitivity of the population to its impacts and the adaptive capacity of the community. So in the case of wildfires, we know that low-income households are, before the fire, less able to afford mitigation measures. They suffer disproportionate mental and physical impacts during wildfires, and they hold a greater proportion of their household assets in their home value, which makes them more vulnerable to financial challenges with rebuilding, and that results in them being displaced more frequently and for longer. Prior studies have also documented social disparities in the health effects of wildfire smoke. Outdoor workers and people experiencing homelessness cannot easily shelter indoors, which is the best way to protect yourself from toxic smoke. And some of the highest levels of hazardous air pollutants during the LA fires were measured downtown near Skid Row and in East and South LA, where residents are already more impacted by air pollution during normal conditions. In prior studies, the risks of being admitted to the hospital or needing to visit an emergency room were shown to be higher because of wildfire smoke, were shown to be higher among women than men, African Americans as compared to whites, Indigenous than non-Indigenous people, and in communities with lower socioeconomic status. Precarious employment also amplifies risks to low-income communities and communities of color in the aftermath of wildfire. So incarcerated individuals, farm workers, and domestic workers are explicitly exempted from major federal labor laws. An estimated 10 to 15% of the state's firefighting force is incarcerated. Farm and domestic workers are often asked to perform arduous work through smoky conditions without adequate protective gear, and many don't get paid if they don't work. Preliminary research by the Latino Policy and Politics Institute and Center for Neighborhood Knowledge at UCLA shows that Latino workers are more likely to be impacted by the LA wildfires compared to those who do not identify as Latino, because Latinos are overrepresented in the formal labor force in the burned areas. That's particularly true in the Palisades fire zone, where Latinos held roughly a third of the jobs, but only represented about 7% of the population. Latinos are also more likely to work in jobs that require a physical presence that can't be done via telecommuting from a remote location, and to be self-employed, lack paid leave and unemployment insurance benefits. There's a lot of concern about the impacts of the Eaton fire on the Black community in Altadena, where historically redlining and racial covenants contributed to the concentration of African-American residents in areas that were more impacted by the Eaton fire. So the UCLA Bunch Center for African American Studies, Center for Neighborhood Knowledge, and Latino Policy and Politics Institute in a preliminary estimate, found that roughly half of African Americans, half of Black homes were damaged or lost during the fire as compared to 40% of Altadena homes overall. And African American families hold a greater proportion of assets in their homes, which means they may have less resources to cover uninsured losses and costs to rebuild, threatening them with displacement and eroding intergenerational wealth transfer. And finally, past experiences suggest that proactive measures are needed to prevent the displacement of long-term residents over in the years to come. So we've already seen intense competition for rental properties in LA's already tight housing market. Price gouging by landlords is illegal, but there's nothing to prevent overbidding, which puts upward pressure on rents across the city. Renters and mobile home residents are less likely to have insurance, generally ineligible for longer term financial support, and are as a result displaced for longer. Low-income housing is often the slowest to be rebuilt, or in some cases does not get rebuilt and is instead replaced with higher priced spec homes. And in general, shocks like this provide opportunities for outside investors to capitalize on depressed home and land values, leading to what's been called disaster recovery gentrification. While rising insurance premiums are also going to happen as a result of these fires across the state, which will worsen the affordable housing crisis we already have, if not coupled with, aggressive climate or fire mitigation measures. So State Farm, for example, has already petitioned for a temporary 22% increase in home insurance premiums as a result of the fires. So we need to stay highly attuned to these structural factors and market forces that worsen the impacts of wildfires and seek opportunities to restructure disaster aid and recovery efforts to prevent further trauma and long-term displacement of low-income households and communities of color.
Thank you so much, Lara, for those really interesting presentation. So it's my pleasure now to introduce our next speaker, Dr. Ruben Juarez, who is the UHERO-HMSA Distinguished Professor of Health Economics, Professor of Economics, and UHERO Research Fellow at the University of Hawaii. He combines microeconomics, network economics, and behavioral economics with public health to address critical issues in underserved communities in Hawaii. He co-founded and directs various public health initiatives, such as the Maui Wildfire Exposure Study, the UHERO Statewide Rapid Survey, and the Pacific Alliance Against COVID-19. He's going to be speaking to us today about results from the Maui Wildfire Exposure Study, focusing on the social and economic impacts as well as health impacts. And we'll also discuss Maui's recovery process from the wildfires that I think will be very helpful to hear for the LA community. So welcome, Ruben.
Hi, thank you, everyone. Thank you for the invitation. And thank you, Lara, for setting the stage, because so what I'm going to be showing is actually contextualize some of the findings that you have for Maui in particular. So, and just to give you, before I start, one key lesson that we've learned is that, and we've done this for a while, is that when people are struggling with housing, jobs, and food security, health is often not their priority. But they should be. And that's why we decided to create this study to be able to not only monitor, but also, nudge individuals to take care of their health. And so, and just to give you an idea about the wildfire in Maui, this is the worst natural disaster in the state of Hawaii. It's the deadliest fire in the US in over a century, threatening, obviously, not only those like the entire community, but also those who suffer from pre-existing health disparities. So the area in particular that was burned is an area that is a little bit far away from, the center of Maui, which is Kahului, basically. And it's about 1 hour away with, significant difficulties of accessing to care and a few other infrastructure. So the study is so we created the Maui Wildfire Exposure Study, which is an truly academic community partnership that involves more than 24 community-based organizations. Some of them are represented here, as well as a scientific advisory board and funding partners, right? Which include initially charitable funding, very important actually at the beginning, and then we transition that to state and national funding. And our research involves surveys, health screenings, biospecimen collections to examine stress, inflammation, environmental exposure. To date, we have almost, we actually crossed 2,000 individuals last weekend who have participated, many of them, actually more than 50% of them, receiving their first medical check since the fires. And what I'm going to be doing today is I'm going to be presenting you some of the key findings. The cohort that we are getting is a very diverse cohort that includes about 30% white, 20% Native Hawaiian, 19% Filipino, 18% Hispanic, Latino, which is very unusual in Hawaii. So outer islands, especially Maui and the Big Island, have a large proportion of Hispanics and Asian populations, non-Filipino Asians, with about 11%. And this is, to date, is the most comprehensive and ethnically diverse study to evaluate short and long-term health impacts after a natural disaster in Hawaii. Pretty good representation of male and females and age groups. And we have a report that is out, but the main trends, and I'm going to go really quick over those today, is that there exists mental and physical health issues, access to care, housing, job, and food security. So for instance, in terms of like mental health, more than 50% of participants show depressive symptoms. And we have a UHERO rapid survey, which is like a statewide survey that we've been following up. Coincidentally, we had one right before the fires done for Maui. And we're expecting about 30% of participants showing depressive symptoms. So you see that significant increase, significant toll in mental health. Similar increases for self-esteem, suicidal ideation. More than 50% of participants told us that their health was worse at the time of collection than before the fire. And those participants who reported frequent exposure to wildfire debris, smoke, and ash tended to experience more symptoms that included respiratory problems, skin and eye irritation, headaches, nausea, chest pain, and fast heartbeat. And then there is a significant increase of cardiopulmonary risk, with 74% of participants facing a heightened risk of cardiovascular disease due to high blood pressure. And again, this is from data that we collect on site. Some of the social impacts, over 70% of the participants who came to the study reported loss of income after the fires, with about 1/3 reporting job loss or looking for employment. And again, I just want to reemphasize that this is data that we collected about 6 months after the fire. It doesn't reflect the situation right now, but there was definitely this huge loss of income and jobs, within the first 6 to 8 months of the fire. Difficulty accessing care was another of the big issues, with 4 in 10 participants reported trouble getting medical care on medications, compared to 1/10 before the fires. And significant disparities on health insurance coverage as well. With pre-wildfire, we knew that about 5% of the population didn't have good health insurance. Post-wildfire, we're seeing about 10%. And this is because people lost their job, so they couldn't get insurance, basically. But one important thing is that we saw significant disparities for Hispanics. And almost half of the respondents experienced very low or low food security. This is substantially higher than the pre-wildfire survey that we had, with about 1/4 of participants. So almost double of the individuals who were food insecure. And one of the good news is that participants trust and use community-based organizations more than FEMA or local government services. And those who use those services tend to fare better in terms of some of the health outcomes that we are measuring, especially mental health. And what worked well for Maui, and again, so I just want to caution that whatever we see here is may just not be applicable for the situation in LA, but since these are different situations, especially since the area that was burned is geographically isolated. But what worked well is that community organizations led recovery efforts where FEMA lagged. Especially, I should say that these nonprofit organizations who are trusted leaders were able to engage underserved populations that were being affected significantly by this. And all of the things that worked really well was a partnership with Kaiser Permanente, who offer free health insurance for those who couldn't enroll in traditional insurance programs. We also developed a real-time data dashboard to be able to inform not only the community, but also decision makers about, some of the health impacts. And the other things like local business donations were essential. And finally, I just want to highlight that a proactive governor actually helped expedite some of the settlements, especially for damage, for housing and things like that. And that actually, I feel that was a good thing for the community. So I believe that, am I on time?
Yeah, you're actually even ahead of time, so that was great.
Okay, yeah. So basically, I'm going to stop here, but some of the practical insights that we have is that these top-down approaches are insufficient. I think stronger collaboration with community is important, and working with some of the health insurance partners has been really helpful. Pre-identify housing solutions for displaced residents was also something helpful as well. We're able to use the hotels in Maui since there was a big capacity for that and no tourism. So, but yeah, thanks everyone.
Great. Well, thank you so much, Ruben, for that really excellent presentation. Excuse me. It's my pleasure to introduce our next speaker, Blake Elia, who is a certified forest therapy guide through the Association of Nature and Forest Therapy, the program manager for the Chico State Ecotherapy program with the Big Chico Creek Ecologic Reserve, and an associate clinical social worker. Blake is also a Type 2 wildland firefighter, passionate about prescribed fires, supporting first responders, and helping wildfire-impacted communities repair their relationships with intentional fire and wildfire-adapted landscapes. So Blake will be speaking about all of these experiences and how she hopes to nurture the health and well-being of Butte County by supporting nature connections and healthy community relationships that might also instill a sense of kinship, reciprocity, and responsibility to protect and steward our local environment. Welcome, Blake.
Thank you so much. I appreciate it. Can everyone hear me okay and see my slides?
Yes, we can hear you and see your slides. Great.
Thank you. All right, so I'm going to move right on past this introduction here. But I'm going to get into how I find myself here with you today. I live in Chico, California, which is near Paradise, California. That was impacted by the 2018 Camp Fire, which claimed 86 lives, burned over 150,000 acres, displaced over 30,000 people, and destroyed nearly 14,000 homes. But I also want to point out that my community has been impacted by numerous catastrophic mega fires over the past 6 years, including the 2020 North Complex fire, the 2021 Dixie fire, and the most recent Park fire in 2024 of July past year. And so you can see the burn scars here on this small map. And what you can't see is the most recent Park fire, which sadly destroyed most of the structures where I work at the Big Chico Creek Ecological Reserve. So what we know and what folks have already shared is, like, we know that catastrophic wildfire has just cascading and all-encompassing impacts on our mental health and well-being. Lovely partners with UC San Diego did research following the Camp Fire with survivors and found significantly higher rates of PTSD, anxiety, and depression. Found that this climate trauma impacted cognition and brain function and led to things like insomnia and substance abuse, which were consistent in long term for many years. And that social vulnerabilities make us more predisposed to mental health issues. So things like adverse childhood experiences, poverty, unstable housing, and health issues. And so after the 2018 Camp Fire, I became a disaster case manager to support folks in their individual recovery efforts, helping them to meet unmet needs, ranging from anywhere from housing to mental health, as well as navigating the complex world of rebuilding. And as I supported my clients in their recovery, one thing that I found that wasn't being talked about in this world was what I later come to know as solastalgia, which is really this form of place-based grief, and it can be defined as the mental, emotional, and spiritual impacts of environmental degradation to one's home environment. So it's really the loss of solace and the feelings of desolation that we experience when one's home or beloved place has been transformed beyond recognition. And so this form of place-based distress and grief over the loss and changes to the landscape and to their home environment really led to a lot of long-term mental health issues and this kind of disenfranchised grief that really just wasn't being talked about, and people weren't able to really communicate or find sources of comfort and healing around this kind of pain. I also found that disaster impacts our sense of place, which is important because our sense of place is integral to our overall sense of well-being and our sense of belonging. And that whenever we experience a disaster that has such dramatic impacts on the land and the places that we love, our sense of place is transformed. Our identity changes. We are no longer able to depend on that place for comfort and solace. Our attachments might be broken, and even the meaning we have of that place might shift. And so with this in mind, my research led me to discover this thing called nature and forest therapy. As a way to really approach some of these, less understudied impacts of natural disaster, and specifically wildfire. And so lucky for me, by some cosmic alignment or serendipity, my local Big Chico Creek Ecological Reserve had just received funding to certify 15 community members to become nature and forest therapy guides to serve folks impacted by the 2018 Camp Fire and provide nature and forest therapy. And this experience was so transformative for me personally. Several of our cohort members were Camp Fire survivors themselves, and we really became passionate because we experienced the healing that this practice could impart, and we wanted to take this further. And that's how the Big Chico Creek Ecological Reserve came to create the Ecotherapy program, which I am now the program manager of. We've been serving wildfire survivors, not just from the Camp Fire, but also the North Complex, the Dixie, and the most recent Park Fire through the practice of nature and forest therapy. We also participated in this wonderful study that really found that nature and forest therapy can be an approach to long-term disaster recovery that is really grounded in trauma-informed care. We know that the protective factors and predictors of well-being include things like emotional and social support, mindfulness, sleep, a sense of community, and what so much research points to is that forest therapy increases mindfulness. It increases our feelings of connection to nature. It enhances our sense of place, improves our mood states, improves sleeps. Multiple studies, even with wildland firefighters, found that forest therapy decreases symptoms of PTSD, depression, stress, and anxiety. So this, is a really hopeful intervention for long-term disaster recovery, specifically in the context of catastrophic wildfire. I think another way that forest therapy might help wildfire survivors is that it can help repair our trauma responses. So this is from a quote from a campfire survivor who shared, "Today is the first time since the campfire that I've been able to feel the wind on my face and have it be pleasant and pleasurable instead of triggering. I can't tell you how amazing that feels." So this really offers this ability to help heal our sensory and trauma responses. Who, with wildfire survivors, our sensory memories, like the smell of smoke and the sound of wind, can be triggering. So to heal that response can be really life-changing. And I'm gonna run out of time here, so I think what for community responses after wildfire is to really shift how we think about community mental health, and not pathologize normal responses to abnormal events, and hold space for grief. After the park fire, I had the privilege of taking ecological reserve staff up to the land to witness the impact, to process that, and also was able to guide them through a grief ritual that we created together. And that was incredibly healing and powerful, and a great opportunity to actually sit with and process that feeling of grief. And if our trauma happens collectively, so should our healing. And I think that our public lands are really spaces for healing, and we need to value them as such. Finally, I want to just say that our context here in Northern California is very different than Southern California. The fire regime in Northern California is really based on frequent low-intensity fires that burn across the forest floor and under the canopy, whereas in contrast, in Southern California, the fire regime there with the vegetation type of shrublands and chaparral is less frequent, rather, fires that are high intensity, wind driven, and stand replacing crown fires. Now, these would, traditionally would have happened less frequently. However, due to human ignitions like utility lines, vehicles, fireworks, these fires have become more frequent. And the frequencies of these fires make it difficult for fire-adapted plants to recover and allow for invasive species to come in and increase our fire risk. Other factors like the removal of native people and their use of intentional cultural fires, combined with severe weather conditions caused by climate change and increased human development in high severity areas. So while this might be difficult to hear, I think I'd be doing a disservice to everyone here if I wasn't honest. This land is meant to burn, and it will burn again. Fire very much belongs here, and if we're going to continue to live in these wildfire adapted landscapes, we need to learn how to do so differently. I know people who lost everything in a campfire, who moved into another WUI community, and lost everything again in the Dixie or Park Fire. So we have to reevaluate where we rebuild and whether or not it's wise to rebuild in these high severity areas. But we also have really helpful tools like home hardening, defensible space, organizing our communities in ways and spacing them in ways to prevent the slow the rapid spread of fire, and joining Firewise communities so that everyone is doing their part to reduce the risk. I'll send out some resources afterwards, but I've got a ton of great resources for folks around home hardening, Firewise communities, fire safe councils that I think can be really helpful in us figuring out how to live in these places and these wildfire adapted landscapes better. Thank you so much.
Thank you so much. That was great and really interesting experiences that you bring to the table. So it is my pleasure to introduce our last speaker, Vickie Mays, who's a distinguished professor of psychology at UCLA's College of Letters and Sciences, and a professor of health policy and management at the UCLA Fielding School of Public Health. She's also special advisor to the chancellor and director of the UCLA Bridging Research, Innovation, and Training Center for Science, or the Bright Center for Science, Research, and Policy. Dr. Mays' research expertise centers around mental and physical health disparities affecting racial and ethnic minority populations. She has extensive experience in disaster response, recovery, and rebuilding of community and mental health systems. And in particular, she has developed, along with her team, a disaster response curriculum for the training of religious leaders, as well as approaches for rebuilding social networks for psychological aid post-disasters. And she will be speaking to us today about community responses to wildfires using both a mental health and environmental justice lens, and also, importantly, bringing her on-the-ground experience from LA. So welcome, Vickie, and thank you so much for being here.
Thank you for having me. Usually it's a very difficult position to be last, but this is actually one in which I appreciate so much what my colleagues had to say. You know, I do think I live in LA, I'm at UCLA, we were close to, you know, the fire impacting us, but we were lucky it did not. Prior to this, I was actually on a call, just to give you a sense of one of the differences with one of my community partners. And it was all about the differences that Altadena has in terms of people finding a place to stay. So there are people who still are in shelters or don't have the capacity to pay, you know, for the amount that is being charged currently for housing. And what's different is, just like at Katrina, these Black families tend to live in proximity. They share meals together, you know, childcare, etc. So for some individuals, when they were burnt out, the rest of their family was as well. So there's no one to go and stay with, and friendship networks were there. So there's still a lot of difficulty right now in terms of housing. What I want to talk about, hopefully, will, you know, prevent some of the things that other people have talked about. And that is, well, let me see here. I'm having trouble moving my slides.
Vickie, do you want us to try to share for you?
Oh, there it goes. Okay. There it goes. Is to prevent some of the outcomes that we've seen. And one of the things I want people to think about is, typically when we go into communities as, you know, we're going in terms of to provide psychological first aid, we're often focusing on the individual. But typically, when it turns out is, by the time we're getting there, if you don't live there, by the time you get there, what people really need is connecting with others. So, you know, unless you live there, you're a stranger. And part of what you need to be thinking about is, what can you do so that you are leaving something that can be counted on, and not your presence, but what are you doing with the community to help them to heal? You know, and it's very important, even in psychological first aid, that we listen and learn. One of the things we often tell people when they go in communities is that, you know, psychological first aid, but you don't know the people that are here. So try and combine, you know, quick, you know, lessons about who people are, how they're responded to. When I was in New Orleans, oh God, it was like people didn't understand. You don't call people by their first name when they were of a certain age. The respectability that was lost, the insults that went on in the name of the delivery of services. So, you know, there was a lot of training that we had to do. So it's important to understand, you know, what are the norms and the expectations in communities that you go in. Ask permission to do things. And that means that you have to be an active listener, and you have to respond to what is the need. You think the need is they want to talk, and the need is really to be respected. Because right now it's like in the Hawaii fires, when you think about it, people are afraid of what's not going to happen, how they're going to be treated, if they're going to lose their land. So sometimes personal respect is actually very important. So what are examples of community responses when I say, like, really go in and think about the community? Well, for example, in Katrina, we made it very clear that the people who could deliver care, who could really talk about counseling, and given that there were very few mental health providers available, were the ministers. So we really worked with them. We determined who had been taught pastoral care, who had pastoral counseling, and who, for example, might even have a degree. so that they actually became a waiting list. That it's like we really work with people to go and talk and see them, and for them to be able to understand the extent to which they could provide services and the extent to which it was beyond their capacity. So we train them up, but at the same time, we help them to understand what is a serious mental disorder and that this person needs to be referred. And there were primary care providers around. In the LA disturbance, which some of you will know as the Rodney King disturbance, what we did was people were so afraid they were locking themselves in their home. This is a very difficult, racism sometimes is very difficult to talk about. So what we did was we partnered with our local PBS station. And that was a time at which people, actually had phone banks, because that used to be how they would raise money. So we got providers to come in, take over the phone banks and talk to people and have some of those difficult dialogues with them and to hear what their fears were and to get them connected to places and people. And in addition to that, part of what we were doing is we were giving advice as well. So we had phone banks in the background, and then we would talk about how we thought people were experiencing things, ways in which to talk to communities. And it really turned out that it made a big difference here in LA of people feeling like, they weren't going to say the wrong thing or do the wrong thing, but instead we could get them to people in which they would be in groups. Big advice: rebuilding back neighborhoods by neighbors, street by street. One of the things I do when I go into communities is really to develop rituals and ways in which to bring the neighborhood back together. And part of that is if you can understand the social structures, like in LA actually has community neighborhood watch groups. People have the emails, they, are able to reach out to people. It's one of the ways that we're hoping to rebuild. There are walking groups, there are church groups. So people are forgetting that they kind of have these, kind of list in which they can get a hold of people. And so we've been working to help them, to figure out a way, even though people are not close by and scattered, to begin to check on people, to begin to think about, like the city was asking, can you work together as a neighborhood so that when we clear debris, we can clear a whole street? So, that means getting together. That means planning together. And actually, people have been finding that a little bit more comforting. And then what you want to do is to increase the community's capacity. And that means organize, revitalize, stand up something that you can lead. And so it is about reaching out to local foundations. It is about telehealth. In order to provide mental health services, sometimes the people who normally would be there to do it are so impacted that they need additional people to help. So it's like, can we use telehealth to provide supervision? Can we use telehealth to use some of our students in training kind of thing? And then also, depending on the infrastructure, can we leave some things online? Can we provide people with self-care so that they need to kind of go off and practice something, if they need to find a way, to be able to be strong for others, that they have the resources to do that without it needing to be one of us there. So, I want to thank you for the opportunity to present this work.
Thank you so much, Vickie, and honestly, thank you to all the panelists for such a really interesting perspectives and discussion. I invite all the panelists to turn their camera on now for the Q&A session. And I'm going to start as we're asking everyone to enter their questions in the Q&A section. And in the meantime, as we're gathering people's questions, I'm wondering if Blake, as well as Ruben, can talk a little bit about some of the interventions you saw on the ground that helped with the sort of social and economic fallout of wildfires in Maui and Butte and Chico counties. I think that would be really helpful also for the LA context to understand that.
So yeah, I can go really quickly on these interventions, but I think that one of the big things you need to realize of Maui is that for the first year or so, we had 2,000, 3,000 people basically being housed in hotels. And this caused a lot of, obviously, mental health issues, mental health concerns, right? I mean, so you lost your house, then you are basically in this tiny room where like you are basically supposed to be eating, people were displaced constantly, switched between different hotels. And for many of the immigrant populations, initially they were told that they qualified for a hotel, and then in the middle of the night, you have security coming over and removing them from the room, right? I mean, to telling them that they no longer qualify. I mean, all of these issues obviously have a huge mental toll on individuals, and I think that what was able to set up is obviously community organizations helping them find housing, even if they don't qualify to the traditional, federal support. So that's one great intervention that we saw. Not only, and people have mixed feelings, but this support that Opera, which was providing, for housing, and as well as basically fill out applications for like Red Cross that to continue some of the housing for immigrant populations was of huge help for the community. From the community. The second aspect is this culturally relevant community intervention that happened on the ground. We have a pretty diverse population, but we lack access to mental health providers who speak Spanish, who speak Filipino, who speak some of the Pacific Island languages. So coming up with these cultural interventions was extremely useful. Initially these were done either via telehealth, or if it was one-on-one, or they were done in big groups. And I found super innovative that, for instance, you didn't need to have a license to be able to provide some of these interventions, right? You could be a cultural practitioner to be able to support individuals. And that, I think, worked really well. Unfortunately, many of the things that we lack is the documentation of the effectiveness, right? I mean, of course, whenever you're in the disaster, you don't collect data in the academically rigorous way that we would like to see. But based on the data that we have from participants in the Maui study, I mean, we are seeing that those who attended at least some of these interventions are definitely having better outcomes than those that don't.
Thank you so much. And that's a great perspective. And Blake, I'd love to hear from you, and then I want to hear if the other panelists have anything to add before we go to the other questions.
Yeah, for us here in Butte County in Northern California, we had a kind of activation of disaster case management system, and that took the form of numerous community social service agencies using case managers that were already providing case management to get assigned to folks under disaster case management to manage their recovery efforts. And this was really effective and it particularly helpful with folks who were underinsured or uninsured to navigate this road to recovery and provide those services. And then there was also a huge outpouring of philanthropy, which Ruben touched on, how important philanthropy and giving is in the immediate recovery, and especially for those who don't qualify for other federal and financial support. And as a disaster case manager, you work with your client to identify unmet needs, and then we would present to a board of donors and people in the community that had the means to give in order to meet those. So it was really, really powerful and helpful in supporting folks who otherwise might have been left behind and wouldn't have received either from our lawsuit payments from PG&E, they didn't qualify for those, or perhaps they were under or uninsured.
Yeah, I think those 2 points are so critical. So, and also I think Blake, you're going to share some resources I think Blake is going to gather some resources to share with us that we will post online about how people can help. And then any other panelists have comments on that? And if not, I'll move to the next question.
Yeah, let me just comment that some of the things that Ruben was talking about are actually still happening right now. People forget about, the LA, and even though Altadena is, we look at it as being quote middle class, there are two things that we're not recognizing, which is our housing market is outrageous. It was outrageous before there were fires. And so some of the people in Altadena may have had a house, but they are not cash rich in any way in terms of the resources that they have. So, and again, this dynamic of having your family live so close to you, there are cases in which, the entire family each lost their home. And so there was no one else to help them. There was no one else to go to. So for some of these individuals, they're still in shelters and hotels. And, think about that. You're middle class in terms of where you live and the kind of job that you have, but your ability to be able to just cope right now, it's as if you're at square one. So part of this discussion I was having right before this presentation was really about, what are some of the other needs? Here, and I will agree with Blake on this, the California Community Foundation, which if any of you watched the Grammys, you saw that they were really selected as one of the go-to community foundations. They have been tremendous at doing exactly what's talked about. Is there are ways in which it takes too long. There are ways in which the structure, for example, of how FEMA and others work, head a household, for example. And so here you've got 4 women and their mom, each having their own household, but because they're now living together, they only want to give, aid in terms of the head of the house. There's a lot of different ways in which our structures, don't meet the kind of intergenerational and different kind of living that individuals with different kinds of income engage in. So so again, what I'm hoping is that for us in LA, we can intervene before we get to some of the responses that I have seen others talk about as the result of not addressing early mental health.
Yeah, that's such a great point to prevention, focus on prevention before you get the mental health sequelae. And along those lines, there's a question here about resources and mental health services that are currently being done to help children affected by wildfires. If you can talk a little bit more about that, those in the LA region.
I think it depends. See, here's one of the issues, which is when we talk about mental health services, sometimes we're talking about wanting diagnosed disorders. And people in the community are a little cautious about having their kids end up with a diagnosed disorder, because then when you try and get them back in school, so some of our, kind of minoritized populations are not looking for that. What they're looking for is church-based services, for example, where, we have some mega churches, we have smaller churches. Some of us belong to that. We will, help out with things. So it's not exactly what people say. And sometimes we get entities like the UC and others that want to step out in the community, provide service, make you a patient. I'll just share one quick thing, which is when I was in New Orleans, I almost made a big mistake, which was I was asked if my team could do assessments of children. And I was like, without a doubt, until I understood. I mean, we last minute said no, because what happened was the school system moved to a charter school. And in charter schools, you do not have to provide certain kind of services. It's not a requirement. And I said, I am so glad we didn't label any child with the expectation there would be services, because it turned out to be months before there were individuals who could actually serve children. So there's a variety of ways to think about whether what you want are mental health services or if what you want are supportive services. And what we've been trying to do is, if we don't see a significant disorder, it really is about supportive services. And it really is about the best thing that could have been done in LA was when kids were put in a school that was a school, when their school burnt down, that was close to them. So they went back to school pretty quickly, and they're with all of their other classmates, even though it's a school that's new to them. So I think you have to think you know,
Mhm.
innovatively about what we want to provide and what it means for the long run.
I just want to echo, Vickie, I really like you. I couldn't agree more about providing as many alternative approaches to this kind of conventional mental health. It's going to be really, really impactful. And I also just wanted to highlight that there's a professional here, a colleague of mine, who's put together resources and some publications about how to support children during and after a wildfire. I put the link in the chat. They're doing that research of how do we have these difficult conversations? What should we be thinking about when we work with children? And so it's just really helpful jumping off point that I wanted to share.
Wonderful. Well, we have 3 minutes left, and I'm going to try to get to 2 more questions with maybe short answers. Ruben, there was a question about if you can talk briefly about the real-time data dashboard that you mentioned, and and then maybe we can provide more resources for people online afterwards.
Yeah, so I'm happy to share that. We have so at UHERO, actually, so I'm part of this organization. Basically, we're the monopolies on data, right, in the state of Hawaii for socioeconomic data as part of the university. One of the nice things is we're able to create 2 dashboards. One of them was to look at specifically focusing on the housing aspect. You know, how is housing being rebuilt? I'm happy to share the links. That has been very helpful. We basically send it to every single legislator, the governor's office, right? Make sure we do a big push so they are able to see and track. And the second thing is, as I was mentioning in my presentation, you know, when a disaster happens, health is never a priority, right? So we wanted to make sure that people understand that, you know, health should be important to enable prevention in the future, And we create this dashboard specifically focusing on the health aspect, as well as some of the socioeconomic aspects. And same thing, I mean, so we did a big push through video presentations, through connecting with the different stakeholders, and it's as well available online. So.
Wonderful, thank you. And the last question, we have 1 minute, and then I'm going to close out, is for Vickie. How are students doing in terms of climate distress, and what is UCLA's community response to support students?
Well, we actually, even during the time where students left, we didn't evacuate them, but some of them left because of air quality. And we have a program where they were being checked on. They could do online check-ins with other students, as well as with, you know, some of the professionals that we had. The second thing is with your center, we're talking about rolling out some interventions for our students. LA students are in all of the UCs, and of course then the UCLA, and actually having some meditation and mindfulness for them, because we're about to get close to finals and what have you. And we know they're pretty stressed out. Not just because of wildfires, but also because of the kind of social changes that we're seeing right now. So we're giving them tools. We're really trying to help them to be able to reach those moments of quietness where they can focus and do the demands that are upon them to be able to produce in their classes.
Thank you so much for that very helpful response. And we are at the end. I just wanted to thank our wonderful speakers and moderator. Wonderful speakers for their excellent insight. Thank you everyone for attending. And I just wanted to announce 2 more things. We're launching a UC-wide, along with what Vickie was saying, a UC-wide communal stress break, which is a 2-week mindfulness series led by our UC-wide Mental Health Council. It's going to be running Monday through Friday from 7:30 to 8 p.m. on Zoom, February 24th to March 7th. So stay tuned for more information, and we'll send out the link to register in the chat. And I also wanted to remind you to sign up for the next webinar next week. The registration link will chat out as well, and it's entitled Wildfire Impacts on Brain and Cognition, which will be moderated by Dr. Tarek Ben-Marnia from UCSD. So thank you all so much. And again, thanks to the wonderful panelists.